Welcome to the video study guide for your Certified Food Protection Manager exam. This video will cover the basics of food safety to prepare you for your training day and exam. All right, let's get started. Let's first begin by talking about contamination. Contamination is the presence of substances or conditions in food that can be harmful to humans. There are three types of contamination: biological, chemical, and physical. Sometimes contaminants can cross over from other substances. This is called cross-contamination. It's the transfer of harmful pathogens from one food or surface to another. Foodborne illnesses are illnesses caused by eating contaminated foods. An outbreak occurs when two or more people experience a similar illness after eating the same food. They require investigation and laboratory analysis. There are three high-risk populations. These are preschool-aged children, the elderly, and people with compromised immune systems due to other illness. Next, we'll talk about bacterial growth. FATTOM is an easy way to remember the requirements for bacterial growth. FATTOM stands for food. Bacteria require a food source to grow. Acidity. Disease-causing bacteria grow best in mildly acidic to neutral foods at a pH of 4.6 to 7.5. Time. Bacteria need time to reproduce and increase in number to dangerous levels. Temperature. Bacteria grow best between 41 degrees Fahrenheit and 135 degrees Fahrenheit. This is known as the temperature danger zone. Oxygen. Some bacteria need oxygen to grow. Some require no oxygen, and some can survive in both conditions. And lastly, moisture. Disease-causing bacteria grow best in foods with a high water content. Now let's discuss time temperature control for safety foods, or TCS foods. TCS foods are determined by the FDA to require time and temperature control to limit the growth of pathogenic microorganisms. TCS foods must be held outside of the temperature danger zone. What is the temperature danger zone? The temperature danger zone is the temperature range where pathogenic organisms begin to grow. This graphic shows the areas where TCS foods are safe, below 41 degrees Fahrenheit and above 135 degrees Fahrenheit. TCS foods include milk and dairy products, eggs, poultry, fish and shellfish, meats, cooked vegetables, cooked grains, baked potatoes, cut tomatoes, cut leafy greens, cut melons, garlic and oil, and sprouts. Another class of foods are ready-to-eat foods. These foods are edible without cooking, washing, or further preparation. For example, washed fruits and vegetables, cheeses, meats, and breads. Now let's learn about the big 8 food allergens. These are milk, eggs, fish, shellfish, wheat, soy, peanuts, and tree nuts. Cross-contact occurs when a food allergen is transferred from one food or surface to another. Next, let's talk about the foodborne illness risk factors that are most likely to cause outbreaks. There are 5 major risk factors. Number 1, improper hot or cold holding. Number 2, Improper cooking. Number 3, poor personal health and hygiene practices. Number 4, using contaminated equipment or utensils. And number 5, purchasing food from unsafe sources. These tools are the most common temperature measurement tools. They are the bimetallic stemmed thermometer, great for measuring thick foods. Next is the digital thermocouple thermometer, good for measuring thin foods. Next is the infrared thermometer, perfect for surface temperatures. And finally, the maximum registering thermometer, which helps measure the inside temperature of dish machines. When using a thermometer, always test the thickest part of the food and wait for the temperature to stabilize before reading. Now let's pause to review with a short quiz. First question. What are the 3 types of contamination? A. Biological, agricultural, physical. B. Biological, chemical, processing. C. Biological, chemical, physical. And D. Bacterial, chemical, and physical. The answer is C. Biological, chemical, physical. Next question. A foodborne illness outbreak occurs when at least how many people experience the same symptoms from eating the same food? A. 1. B. 2. C. 3 people. Or D. Any number of people. The answer is B. At least 2 people. Next question. The O in Fat Tom stands for A. Oxygen. B. Osmosis. C. Outbreak. Or D. Other. The answer is A. Oxygen. Great job on your quiz. Now let's talk about sanitizers. There are 3 types: chlorine, iodophores, and quaternary ammonium, or quats. Here are some important water temperatures to know for your exam. At a hand sink, the water should be at least 100 degrees Fahrenheit, but not too hot to wash your hands. In the wash basin of a 3-compartment sink, the soapy water should be at least 110 degrees Fahrenheit. For a stationary rack dishwashing machine, the final rinse temperature should be at least 165 degrees Fahrenheit. When using hot water to sanitize, when manually washing dishes, the water should be at least 171 degrees Fahrenheit. And lastly, the final rinse temperature of a high-temperature dishwashing machine should reach at least 180 degrees Fahrenheit. Now let's talk about some food safety agencies and their roles. The FDA, or Food and Drug Administration, writes the Model Food Code and controls all food except meat, poultry, and egg products across state lines. They conduct inspections of food processors. The USDA, or U.S. Department of Agriculture, controls meat, poultry, and egg products across state lines. They conduct inspections of these meat, poultry, and egg processors. The CDC and Public Health Service both perform research and foodborne illness outbreak investigations. The Occupational Safety and Health Administration, or OSHA, sets regulations for worker safety and requires safety data sheets for workplace chemicals. And finally, state and local health departments perform inspections of retail food establishments. They write and adopt the local food code and perform pre-opening inspections, plan reviews, and issue variances for special processes performed in retail food establishments. How long can food be left at room temperature? For hot foods, they can be left at room temperature for up to 4 hours, then must be discarded. For cold foods, they can be left at room temperature for up to 6 hours, as long as the temperature does not go above 70 degrees Fahrenheit. Now let's discuss HACCP. HACCP stands for Hazard Analysis Critical Control Point. HACCP was developed in the late 1950s by a team of food scientists and engineers from the Pillsbury Company and the National Aeronautics and Space Administration, or NASA. The team developed a system designed to build quality into the product and ensure food safety for the manned space program. Let's take a look at the 7 principles of HACCP. HACCP is a system for determining and preventing food hazards in food preparation. In step number 1, we'll conduct a hazard analysis. In this step, you're asking what could go wrong by analyzing the biological, chemical, and physical hazards present in the flow of food throughout your facility. In step number 2, we're going to determine our critical control points, or CCPs. Determining your CCPs means that you're deciding which of the steps are most important to prevent foodborne illness. In step number 3, you're setting critical limits. In this step, you're assigning a value to each of your critical control points. For example, what are the actual temperatures, times, pH, water activities, etc., that will help you prevent the hazard? Step number 4, conduct monitoring. How do you know if a CCP has been met? The only way is to monitor for critical limits. In this step, you're recording who monitored, how often, and how the monitoring was conducted. Principle number 5, establish corrective actions. What do we do if the critical limit is not met? This decision-making process should be documented in the corrective actions portion of the HACCP plan. Principle number 6, verification. In principle number 6, we try to determine if our HACCP plan really does prevent foodborne illness. We also determine if what we're doing is what we said we were going to do. Is our HACCP plan being properly implemented? And finally, principle number 7, record keeping. If it's not written down, it didn't happen. There has to be a plan about what records we'll keep and for how long. Let's talk about water inside of a retail food establishment. Water inside a retail food establishment must be potable. Potable water is water safe for drinking and cooking. A physical link between dirty water and safe drinking water and a plumbing system is called a cross-connection. Cross-connections should be avoided at all times. Proper hand washing is extremely important in a retail food facility. The steps to proper hand washing are: wet your hands with water that is at least 100 degrees Fahrenheit. Next, apply soap and scrub your hands for 10 to 15 seconds. rinse thoroughly, and then dry with a paper towel or air dryer. The entire hand washing process should take at least 20 seconds. There are a few requirements for hand washing sinks. Hand washing sinks should be dedicated to hand washing only. They should never be blocked or used for storage. All hand washing sinks must have 5 basic requirements. 1. A hand washing reminder sign. 2. Soap. 3. Paper towels or an air dryer. 4. Hot and cold running water, at least 100 degrees Fahrenheit, but not scalding. And finally, a trash bin for disposing of paper towels. Let's break for a few more quiz questions. Which of these is not one of the 3 types of chemical sanitizers? A. Hydrogen, B. Chlorine, C. Iodophores, or D. Quats? The answer is A. Hydrogen. Next question. How many HACCP principles are there? A. 3, B. 5, C. 7, or D. 9? The answer is C. 7. Last question this round. Water for hand washing should be at least A. 90 degrees Fahrenheit, B. 60 degrees Fahrenheit, C. 100 degrees Fahrenheit, or D. 110 degrees Fahrenheit. The answer is C. 100 degrees Fahrenheit. Let's continue with our lecture. Next up, hand washing. When is it appropriate to wash your hands? Always wash your hands prior to beginning food handling. And always wash your hands after the following: eating, drinking, smoking, using the restroom, touching your hair, face, or other areas of the body, after handling raw meat, seafood, poultry, fruits and vegetables, and prior to handling ready-to-eat foods. Wash your hands after coughing, sneezing, using a tissue, after handling the trash, chemicals, or conducting any cleaning operation, and prior to handling any exposed food items. Always wash your hands before putting on disposable gloves for working with food. Personal hygiene and employee health are very important in a retail food establishment. As a certified food protection manager, it is important to execute employee health policies, ensure proper hand washing and hygiene. Always monitor employee behaviors related to smoking, eating, drinking, single-use glove use, and the proper storage of employee personal belongings. A written employee health policy is expected for every food employee. This policy should include telling employees that they are responsible for reporting certain illnesses and symptoms to the management, instructing management that certain illnesses and symptoms must be reported to the health department. Also, they should know if an employee should be excluded from work. And finally, the health policy should determine when an employee can return to work. There are 6 foodborne illnesses that are required to be reported to the local health department, also known as the regulatory authority. The following illnesses are easily transferable to food and can cause disease with a low infective dose. The FDA Food Code requires employees to report to management a diagnosis or exposure to any of these big 6 foodborne illnesses. They are Salmonella typhi, Salmonella non-typhi, E. coli, Shigella, hepatitis A, and norovirus. Additionally, if an employee has any symptoms that prevent them from working with food, they must report them to a manager. A manager must exclude sick workers from the establishment if they report any of the following: vomiting, diarrhea, jaundice, a sore throat with fever, especially when working with a high-risk population, and finally, any infected wounds or boils on hands or arms that are uncovered. Good personal hygiene is a key factor in preventing foodborne illness and cross-contamination. Proper hand washing is one of the most important things you can do to protect customers from illness. Hand sanitizer may be used after washing hands, but is never a substitute for proper hand washing. Cuts and lesions must be properly bandaged and then covered with single-use disposable gloves at all times for all food preparation activities. Hair restraints must effectively pull hair off of and away from the face. Beard guards must be used when necessary. Uniforms must be neat and clean, with no evidence of food or soil from the previous day. Do not wear jewelry, including medical alert bracelets, on hands and exposed arms when working in food production and warewashing areas. The only exception is a plain smooth ring. Let's talk about disposable glove use. The use of disposable gloves adds an extra barrier to help prevent contamination. Gloves protect food from direct contact. You should always wear disposable gloves when working with ready-to-eat foods. Washing hands before putting on gloves is mandatory, especially when starting a new task. It is not necessary to rewash hands when displacing closable gloves if performing the same task and the hands have not been contaminated. Produce may be washed without wearing disposable gloves, unless you're serving a high-risk population. Always change disposable gloves when switching between raw and ready-to-eat foods. Also, change gloves if they become ripped or contaminated. Never reuse or wash disposable gloves. And remember, disposable gloves are never a substitute for proper hand washing. The last section of this video study guide is about cooking temperatures. There are 4 main cooking temperatures to remember. They are 165, 155, 145, and 135. Let's start with 165 degrees Fahrenheit. Foods cooked to 165 degrees Fahrenheit must reach this temperature for less than or equal to 1 second, or instantaneously. The following foods must be cooked to 165 degrees Fahrenheit. They are poultry, including ground poultry, stuffing made with meat, fish, or poultry, stuffed foods, including stuffed meats, stuffed poultry, stuffed seafood, stuffed pasta, etc. Any TCS foods previously cooked that are being reheated. And finally, any food being cooked in a microwave. The next temperature is 155 degrees Fahrenheit. Foods cooked to this temperature must reach this temperature for at least 17 seconds. These foods include ground meats, including ground beef, ground pork, ground game, and ground fish, including sausages, any injected meats or mechanically tenderized meats. The cooking of ratites, such as ostrich and emu. And finally, eggs for hot holding. The next temperature is 145 degrees Fahrenheit. Foods cooked at this temperature must be cooked for a minimum of 15 seconds. These foods include whole muscle beef, pork, and wild game, all types of fish, and eggs for immediate service. The last temperature is 135 degrees Fahrenheit, with no minimum cooking time. The foods that should be cooked to this temperature are vegetables that will be hot held for service. Let's pause for one final quiz. What is the only type of jewelry allowed when working with food? A. Medical alert bracelet. B. Plain smooth ring. C. Wristwatch. Or D. Earrings. The answer is B. Plain smooth ring. Next question. Disposable gloves should always be changed A. After changing tasks, B. After working with raw foods, C. After cleaning, or D. All of the above. The answer is D. All of the above. And your final quiz question is, ground chicken should be cooked to what minimum internal temperature? A. 155 degrees Fahrenheit. B. 165 degrees Fahrenheit. C. 135 degrees Fahrenheit. Or D. 100 degrees Fahrenheit. The answer is B. 165 degrees Fahrenheit. Great job on your quiz. That's the end of this video study guide for your Certified Food Protection Manager training and exam. We hope you've learned a few things that will help you on your exam and in your career as a retail food facility manager. Best of luck!